Welcome back. I'm Miguel, your local respiratory therapist, and for our medical news story today, in honor of November, I will be speaking to you about the wonderful world of COPD. And wonderful indeed it is. Now, you may be wondering, well, what is COPD? So, COPD stands for chronic obstructive pulmonary disease. It's ongoing lung conditions caused by damage to the lungs. It can result in swelling and inflammation, and it can even limit airflow, which makes it an obstructive pulmonary disease. Now, a few signs that us as respiratory therapists may notice on our patients and some symptoms that they themselves may experience will be trouble breathing, which is a very obvious one, coughing on the daily, which can bring mucus and phlegm, if they experience any wheezing, which are whistling sounds in their lungs, if they have constantly experiencing a tight chest, if their chest feels heavy, if they have frequent lung infections, if they experience any swelling, like in their ankles or legs and their lungs, of course, and if they experience some undesired weight loss. Unfortunately, COPD is not curable, but with proper management, patients are actually able to control their symptoms, and by doing so, it can actually reduce their risks of heart failure and even lung cancer. Now, there are certain communities who are more at risk for COPD. Well, the communities that are most likely to get COPD will be current smokers or former smokers, those that have an asthma history, and our older community, and even women. Women specifically because women tend to have smaller bronchial tubes and smaller lungs than men. So when women inhale the same amount of smoke that men do, it can actually cause more damage to their lungs due to their lungs and bronchial tubes being smaller. Now, how these communities could get it would be through smoking, of course. So if you're a smoker, I recommend putting that lighter down. If you experience secondhand smoke, which would be inhaling smoke that somebody else is breathing out, and if you just happen to be exposed to the environment, such as a workplace that contains breathing hazards. So if you happen to work in an environment as such, please make sure to always wear your proper PPE. Regarding the science, the lung microbiome actually plays a role in health and disease with COPD. Now, the microbiota does not do well with change, so if there's any disturbances or changes with it, it can actually influence and even worsen COPD. Now, in healthy lungs, you could find lactobacillus, which is a firmicute. It can actually help improve lung structure, helps reduce pro-inflammatory markers, and it can even prevent the common cold. You will also find in healthy lungs Bacteroides cacae, which is a bacteroideate, which is a bacteria that kills and stops growth from other harmful bacteria. It provides nutrients to other microbiomes, such as in the gut, and it can also help reduce inflammation of the lungs. Now, in lungs with COPD, you will find a proteobacteria known as Haemophilus influenzae, which can actually cause several kinds of infections like bronchitis, pneumonia, and COPD. It can be cured with antibiotics, but although it can be taken away, it can still have certain long term effects such as hearing loss, meningitis, and, again, COPD. And it can actually be contagious and it can be spread through coughing and sneezing. Something else you'll find in lungs with COPD will be Clostridium subterminale, which is rare, but once infected, it can be very serious. It leads to certain lung infections, and it can be cured with antibiotics like penicillins, but it can cause long term effects in immunocompetent hosts, and it can actually infect the skin and the soft tissue. Now, I want to go more in depth with Haemophilus influenzae. Usually, when a patient comes in with all the signs and symptoms of COPD, H. influenzae is usually one of the first things that we test them for. And the way we test for Haemophilus influenzae, we can perform gram staining tests. These stains help us look for the bacteria. And we can perform body fluid culture tests to confirm the presence of bacteria. And we will take urine, blood fluid, or even spinal fluid. Now, research is being done regarding Haemophilus influenza, but more is needed to understand it. For now, researchers do recommend parents to give their children under 5 years old the vaccine known as HIB, which can help prevent critical conditions. And it's usually not recommended for adults except if the adult has yet to receive the vaccine or if the adult just happens to be in critical condition. Now, regarding COPD, there's a procedure known as the bronchoscopic lung reduction, which is where doctors place a very small valve in the airways to help reduce the damaged lung. This is done in order to help the patient breathe better and to improve their quality of life. Well, there you have it, folks. And now that you're educated in the wonderful world of COPD, always remember, stay safe, stay healthy, and keep breathing. Nah, I'm just kidding. I'm still calling from work though.